You to please all rise while we welcome the class of 2016. Please be seated. First of all, I would ask everyone to join me in thanking the Zen Trio for our live music for today's ceremony. My name is Chris Ireland. I'm the Dean of the College of Pharmacy. And if you look at your program, you'll note that this ceremony was intended to be directed by Associate Dean Mark Munger. But Mark was asked to testify for a committee in Congress today in Washington, and both he and I agreed that in the current climate of healthcare reform, it's important that pharmacists have a say in this process. So your program really should have a little insert that says playing the role of Dean Munger today is his understudy. And I'm certainly delighted to be here and have the opportunity to oversee this celebration. We in the college are all delighted that you as family and friends of the class of 2016 have joined us here today. All right, so I have to give you another warning. Apparently the football team is starting practice right at 3 o'clock, and they apparently use live ammunition for their, that's how we're going to compete in the Pac-12. So there will be some interruptions, I'm afraid, today, so please bear with us. But we're really here to celebrate a very important day in the lives of these students in the class of 2016, because this ceremony really represents the transition for them from an undergraduate education to their professional pharmacy-based education, which is much more of a clinical-oriented education. And it also, I think, marks for these students the beginning of their career path, which represents a personal decision on each of their parts to pick a career that's based on service, and where the focus for all of them will be more on the caring and the health care for others rather than focused on themselves. And I certainly want to congratulate all of them for making that very important decision in their lives. To give you a little bit of history on white coat ceremonies, it turns out that the first white coat ceremony that we can document occurred at the University of Chicago in the College of Medicine. Interestingly, it wasn't that long ago. It was back in 1989. So it's a relatively new ceremony in the health sciences, and it really was intended to mark the initiation of young physicians into the practice of clinical medicine or clinical studies. And since that time, since 1989, it's been adopted by virtually all of the healthcare professions. And in fact, this now represents the University of Utah College of Pharmacy's 10th annual white coat ceremony. And so it's a tradition that we have embraced, and we are very proud to be part of that tradition. One of the things that you'll note in your program is that there is a listing of the donors who have bought the white coats for our students this year. And this is, again, a wonderful tradition in the college that most of those names are alumni of the college, and they have now bought the coats for the students in the current class. And each student knows the name of the donor who represented or bought their coat for them. So it's a wonderful tradition that we've created here for the students to interact and now essentially get to know their former classmates as well. Before we actually begin our formal program, I did want to take an opportunity to recognize some special guests that we have here today. We have a number of department chairs from the College of Pharmacy, and I'm going to ask these individuals to all stand and remain standing, and then we'll do a general applause for all of them at the end of the introductions. So first off, we have Dr. William Crowley, who's the chair of the Department of Pharmacology and Toxicology. And these are individuals, I think, that the students and all the families should get to know, because these are the people that control your lives now. We have the chair of the Department of Pharmacotherapy, Dr. Diana Brixner, also in the front row. And on the opposite side, we have the chair of Pharmaceutics and Pharmaceutical Chemistry, Dr. David Granger. We also have with us today the president of our University Alumni Association, our College of Pharmacy Alumni Association, Dr. Tina Aramaki. Please stand. Tina is the Director of Pharmacy Services for the Intermountain Healthcare System. We also have with us today the Executive Director of the Utah Pharmacists Association, the UPHA, Reed Barker. Reed, please stand. And we also have with us the President of the Student Pharmacist Alliance, Emmeline Tran. Emmeline, please come forward a little bit so people can see who you are. Again, these are all important people that I'd like to see you get to know over your time. Finally, I'd like to ask all the faculty who are here to please stand and be recognized. These are your mentors and your teachers over the next 4 years. There are a number of them hiding over here in the corner that you'll get to know very well. So please join me in thanking all of these individuals. I'd also like to take a moment and give special thanks to the people who work behind the scenes, those people that make a ceremony like this possible. And so I'd like to recognize the members of my staff who have worked tirelessly to make this happen, and they're all hiding in the back, and I'm going to make them at least wave their hands. So Marion Lindberg in the orange in the back, standing next to her, Denise Brennis. As we move across the room, Stephanie Hsu in the blue dress. And let's see, where I'm looking for one other one. Where is she? Well, she's hiding over here. Please stand up and be acknowledged. And let's see, who else? Oh, we have some others from our IT group that are photographing the session as well. So again, thank you all in the staff for making this such an important presentation. So as we start our formal program today, we have a couple of events. One will be the awarding of the coats for the students, but this is also an opportunity where we recognize a distinguished alumni each year. And so the Alumni Association each year awards what we call the Heiner Prize, or the Heiner Award. This goes to the Distinguished Alumni of the Year. And I'll ask Dr. Tina Aramaki to come join me on the stage.
Oops. It is a real pleasure for me to bring this distinguished alumna before you today. Erin Fox graduated from the See, I always get misty. I'm a crier. Erin Fox graduated from the College of Pharmacy with a Doctor of Pharmacy degree in 1999, and then completed a specialty drug information residency at the University of Utah as well. And she has been practicing at the Drug Information Center since that time and is now the director of that service here at the University of Utah. I'm going to just read a couple of excerpts from the letter that was submitted. I have always looked up to her as an expert in drug information practice, and I know multitudes of others have come to recognize her name as synonymous with accurate and effective drug information. We had some quotes in the letter from her current staff that worked for her, and I won't read all of those, but I will say that that the point of most of their comments is that she is a consummate professional and she is a true leader that helps them excel and become the best that they can be. And aside from the accolades of her staff and her colleagues, Erin is known nationally for her advocacy efforts in the management and problem solving around drug shortages. And if you're not aware, you will be very soon, that this is a national crisis, that we have a lot of big problems in our country with the inability to get drugs that we have come to depend on. And the work that Erin has done and is doing is having a significant impact. She truly takes very seriously the stewardship we as professional pharmacists have for the communities in which we live and serve. She's participated in many interviews, both locally and nationally, and has been quoted very often in print. This last year, she received the American Society of Health System Pharmacists Award of Excellence, and that recognizes her significant contributions which have advanced the ability of hospital and health system pharmacists in the U.S. to serve their patients. I have had the honor of knowing and receiving the benefit of Erin's knowledge and contributions, and I believe she's an excellent candidate for this award. Erin was unable to join us today because of death in her family, and so we're very sorry that she's not here to receive it, but would like to recognize her contributions.
Thank you, Tina. Next part of our program is we invite a guest speaker to come and address the students, and we like to try to pick alumni of the school who can perhaps come and give the students some advice on what it's like to be a pharmacist, and perhaps what the opportunities that lay ahead of you are. So this year our special guest is Dr. Richard Hamill. Dr. Hamill joined was a student at the College of Pharmacy, receiving his Bachelor's of Pharmacy degree in 1960, received a PhD in pharmacy in 1965, and he is a registered pharmacist in both the state of Utah and California. To place a little bit of this in perspective, when Dr. Hamill was a student in the college in 1960, there were 4 faculty in the entire college, and the college lived in the women's gymnasium, which is in President's Circle, just over here on the other side of the parking lot. So we've come a long way. And what was then the Department of Pharmacy, where Dr. Hamill received his PhD, is now the Department of Pharmaceutics and Pharmaceutical Chemistry. Dr. Hamill has practiced his pharmacy degree and education in a number of facets of professional pharmacy. He's been heavily involved in industrial company-based pharmacy, starting with his work at Baxter Laboratories, where he was involved in studies of quality control. From there, he went to G.D. Searle, where he was in charge of quality control and FDA compliance, and reported directly to the then president of the company, a gentleman named Donald Rumsfeld, who many in the audience may recognize as a subsequent Secretary of Defense of the United States. And was given complete control over making sure that the Searle company was completely FDA compliant. Subsequent to that time, he started his own companies and his own consulting firms, and has started a number of very successful companies during his career. He's also been very active in the giving back or the service aspect of the program, and has received a number of service awards from Orange County, California, where he lived for many years, and also from the Republican caucus of the state legislature of California for his work in giving back to the community. So I'd like to ask Dr. Hamill to come and address the class of 2016.
You don't know, but you gave part of my presentation. Well, thanks for that nice introduction. It really is an honor to be back at the U. I've been away for a long, long time, and I was hoping that those dates wouldn't slip out, 1960 and 1965, but maybe that's the reason I'm balding now and have gray hair. What I'd like to do today for you, the new students, is really impress upon you the many opportunities that are available in pharmacy, and not just in the traditional pharmacy of community pharmacy or clinical pharmacy, but an area which I'll call, in general terms, industrial pharmacy. And there's really quite a role for you there. So let me do that by tracing a little bit of my career and the things that I got involved in over the period of the last almost 50 years. I started my career in the usual way of passing the boards in both Utah and California. And I started as a community pharmacist in a part-time way here in Utah while I was going to graduate school. And that all worked fine until I had a nice plan and how that was going to go in a very orderly way, until I met a little blonde lady who happened to be a law school student, and she kind of changed my whole life at that point in time. And we got married that first summer, and in a couple of years had the first child. Now, what did that mean for me? Well, I was supporting myself by working part-time as a relief pharmacist in a number of pharmacies in the valley here. So the good thing about pharmacy was when you needed more money, you just worked more hours. And that made it a little bit hard, but nevertheless, I was able to continue my pharmacy work as well as my PhD work. Now, after I finished my PhD, I wanted a career in industry, but I didn't know what was available, and I didn't even know how to get started. And the problem was that there was no one on the faculty. I'll go back to what Chris said. There were only 4 faculty members at the time, none of whom had any experience in industrial pharmacy. All of their experience was in academia. So I plunged ahead anyway and took a job with a company called Miles Laboratories. Now, Miles was known at that time, and probably still is, for making Alka-Seltzer. And where did I land in that company? Well, the only place that I knew to apply, namely in R&D. But you know, after a little while, I got tired of making new formulations of Alka-Seltzer. I mean, that was not really very exciting, or new one-a-day vitamins. Or you wouldn't believe, I even worked on a project to make hairspray. But one of the things that I noticed, because I keep my eyes open, I found in a company like that, which was actually a large company for pharmaceutical companies, I met a number of employees who were pharmacists who worked in different parts of the company organization, all the way from marketing to manufacturing and R&D naturally, and other areas. And I said to myself, wow, there must be some opportunities over there. I need to learn a little bit more about that. Well, I found that that was just the bigger picture of pharmacy. And so it was, very quickly, I said, I've got to get out of here, and I've got to find the right company and the right opportunity. And I wanted to focus on an administrative job because I was sort of a weirdo when I was doing my PhD. They asked what did I want to minor in, and I said, I want to minor in business. Now, can you imagine these 4 faculty members, which constituted the faculty? They said, business? Don't you want to teach? And I said, no, not at all. No. I want to go into industry, and it seems to me that maybe having some educational experience in business might be a good companion with my scientific background. So I did that. Now, I started looking for another job, and something unique came along. Maybe not many of you remember or knew while he was alive a gentleman by the name of Dr. Ewart Swinyard. Dr. Ewart Swinyard was one of those 4 faculty members and was one of the sweetest men that you would ever want to know. I considered him a mentor, even though he was not part of my PhD committee. But he took a liking to me, and I to him. And I applied for a job at Baxter Laboratories. At that time, that was a very small company. And lo and behold, I found out that the man that I was being recruited by used Dr. Swinyard as a consultant. So naturally, I worked that angle, extensively, and I got the job there. And the neat thing about that was that that good relationship that I had with Dr. Swinyard as a student, I continued afterwards because he came to Baxter periodically, and we were able to keep a relationship going. So the job that I happened to get there was a job that, frankly, I didn't apply for. I applied for a job, and I don't even remember what it was. But when I arrived for the interview, they said, well, you're going to talk to the vice president of R&D because he's looking for an assistant. And I said, sounds good to me. Well, I got that job. And Ewart Swinyard was a principal reason for that. And after 4 years, I got exposed to different parts of the company: research administration, quality control, quality assurance, clinical research, FDA regulatory affairs, which were all areas that were under his jurisdiction. And then after about 4 years, I was transferred to a division of Baxter's in Southern California called the Highland Division. And the Highland Division, this happened to be a turnaround situation, which was another great opportunity for a young guy to be a part of. The Highland Division had the largest market share of therapeutic plasma fractions. Now that name may not mean very much to you right now, but it will be later. Therapeutic plasma fractions are albumin, antihemophilic factor, gamma globulin, etc. And then also that was compared with diagnostic reagents, both of which they had major market shares. Well, that gave me a new opportunity to learn. And I was always looking for those opportunities that not only could I grow, but I could also learn something that was new. And I went there as director of corporate compliance. This was a very successful time. But what was going on in the industry was that a company named GD Searle, which happened to be close by in the Chicago area, was having tremendous problems with the FDA. And so I sent a letter in thinking that, they might be interested in my background. And sure enough, they hired me. And Chris already mentioned that I worked for Donald Rumsfeld. And I had fantastic responsibilities. For a young guy in his late 20s to have responsibility worldwide for all of the regulated activities of a company that not only made pharmaceuticals, but made medical devices and diagnostic products and instrumentation, and having sole responsibility for the assurance that their activities were performed according to FDA standards. And if they weren't, having the responsibility with my sole authority to close that operation down. Now, that really that humbled you. And I used that authority with real discretion, but I had from time to time situations where some senior members of the staff would try to go over my head and complain to Rumsfeld. Well, he didn't stand for that one bit. He said, if Hamill said that you're not doing it right, then close shop. Well, another learning responsibility. So I got that job, sort of got the company in very good shape. But about that time, there was something new happening in industry, and that was the development of biomedical devices. Until 1975, the FDA had no responsibility for biomedical devices. They tried to, but there was no legislation behind what their actions were. And once they put that in and developed regulatory programs, this made some new opportunities, and I was always looking for new opportunities. So I started a small consulting business in which I went around to small companies who couldn't afford to hire the kind of people that they needed to hire to put these kinds of programs together. And I made a very successful consulting business out of that. Well, that was fine for a period of time. But that made me at that point kind of look back what had happened over the last 20 years. I had an experience in community pharmacy, then I went into industrial pharmacy, and I had experience with pharmaceuticals, medical devices, and diagnostic products. Diagnostic products, by the way, are by definition medical devices. So I also, at that point in time, was sort of the expert on regulatory affairs and quality control. But I wanted some change, so I wanted to get back into industry. And that brings up then the next 30 years of my career. At that time, or during those years, I was really focusing on co-founding startup companies, but startup companies in areas that I had some experience. The first one was Highcore Biomedical, which was a diagnostic company. The second one was Autogenomics, which you will hear more and more about because they're going to go public in probably about 3 months or 4 months. Autogenomics makes diagnostic products, gene-based diagnostic products. This is revolutionizing the practice of medicine because the information that they're providing physicians is giving them, the physician, the opportunity to do things that he hadn't been able to do before. Then the last company was BrightAge, totally different. It's a nutritional company, and you're right in the heartland of nutritional products here in Utah. And we have created a formulation made of natural products that improve memory and focus and concentration. And even though the FDA doesn't require clinical testing to support claims, we had a clinical program done in Australia at a very famous brain research institute because that's the way we had always operated in the companies that we were with. So, what are some similarities through all of this? The similarities are the ways R&D is done is the same. The need for complying with FDA responsibilities is the same. I look back on my background and found that my background in pharmacy gave me the ability to play in all of these different areas. And that's what I would really like to leave with you today, is that if you want to look at non-traditional pharmacy, and I mean by not talking about community pharmacy or clinical pharmacy, I mean nothing negative about that, because I knew for the next 4 years you're going to get that in spades. But if you're talking about non-traditional pharmacy, there's a lot of opportunities that are going to be available. So don't discount that. Keep your eyes and ears open over the next 4 years, because there may be something there that might excite you. And lastly, I want to talk to your parents and say your kids have made a great decision for their career and for their academic program going forward. And I want to wish you the best over the next 4 years. Success, and maybe we'll talk later as you get closer to graduating and you'd like to know a little bit more about how to explore some of these non-traditional opportunities that I just talked about. So good luck and best wishes.
Well, thank you, Richard, for really opening up, I think, everyone's eyes to the fact that pharmacy education is an incredible opportunity to explore something on the order of 1,700 different career paths. So I think that's something that all of you should think of as you go through the program. So now I think we're getting to the business part where we go to our notes and figure out what we're going to do. Okay, so this is where we will award, or it's in essence coat, the class of 2016. I'm going to ask my colleague David Young to come up to the podium. David will announce the students, and then they will come up and they will be coded by myself and Dr. Hamill. And as they come off the stage, then you will be given alumni pins by the alumni president, Dr. Tina Aramaki.
It's indeed an honor to be here to read the names. This is our 10th anniversary, and this is my 10th anniversary of doing this, and it's a huge honor to be up here and before you as a class. One quick thing, speaking of opportunities and hats, I wanted to welcome you from the Board of Pharmacy. One of the hats that I wear, an opportunity that came through pharmacy, would be being the chairman of the Board of Pharmacy. So I welcome you from them, and they're excited for this white coat ceremony for you, because what that white coat signifies for you is a high standard. So wear that coat as a symbol of a high standard, and when you're not wearing that coat, hold yourself to a high standard, because that's what we do as pharmacists. Be involved and never lose the fire to learn, I think, are a couple other things I think the board would want you to know. And with that, we'll start with the class of 2016.
So make sure you tell they should go and sign the pledges.
Oh, yes, a little bit of business. As you're after you get your coat, you'll pass through and you'll get your pin, and then we'll have you sign the professionalism pledge as well. So with that, we will start. Well, I guess we'll have the first row. Should we just have them stand up and come across, or should we?
Yeah.
Okay, well, we'll just start. So if you guys want to stand up, and I don't know if you want to, should we have them come?
Yeah, actually
Line up to the left over there. I guess my left, your right. Cade Adams. Stephen Adams. Christian Armstrong. Tim Benvenu. Meryl Wazecki. Megan Berzink. Jessica Rose Carey. Joseph Chang. James Clark. Candace Colby. Jordan Ferguson. Heather Frey. Gregory Hadlock. Chelsea Hancock. Michael Holt. Whitney Irvine. Cameron Johnson. Jill Johnson. Jamila LeBeau. Chu Lao. Gloria Lee. Louis Lim. Tracy Louie. David Malmrose. Ryan Markham. Adriana Munoz. Kyle Murray. Blake Myers. Rima Naeem. Aaron Nacken. Thuy Tien No. Eric Oborn. Irene Pan. Kathy Fan. Aubrey Pimsicle. Andrew Portier. Anthony Pudich. Jonathan Red. Taylor Green. Kaylin Roundy. Natalia Ruiz. Katie Savage. Mark Sears. Nelson Sisson. Carissa Snow. Russell Spute. Laura Steffens. David C. Amy Tejeda. Kirsten Throm. Justin Tran. Anthony Travato. Derek Tully. Tony Valdez. Douglas Van Cowenberg. Elena Rontakis. Shixiang Wang. Karen White. Josh Wild. Susan Woods.
So would the class of 2016 please rise? Would everyone please join me in congratulating this class? Okay, I'm going to ask you to remain standing. And I'm going to invite Matt Alvey, who is a P4 student, to come up and administer the pledge. Matt?
And for those of you who'd like to follow along, it is on the back of the program, so you know what they're saying here. Would everyone please read the pledge along with me? As a student of pharmacy, I believe there is a need to build and reinforce a professional identity founded on integrity, ethical behavior, and honor. This development, a vital process in my education, will help to ensure the personal relationship I establish between myself and society as I become a member of the pharmacy community. Integrity will be an essential part of my everyday life. I will pursue all academic and professional endeavors with honesty and commitment to service. To accomplish this goal of professional development, as a student of pharmacy, I should develop a sense of loyalty and duty to the profession by being a builder of community, one able and willing to contribute to the well-being of others, and one who enthusiastically accepts the responsibility and accountability for membership in the profession. Foster professional competency through lifelong learning. I must strive for high ideals, teamwork, and unity within the profession in order to provide optimal patient care. Support my colleagues by actively encouraging personal commitment to the oath of pharmacist and a code of ethics as set forth by the profession. Incorporate into my life and practice dedication to excellence. This will require an ongoing reassessment of personal and professional values. Maintain the highest ideals and professional attributes to ensure and facilitate the conventional relationship required of pharmaceutical caregiver. The profession of pharmacy is one that demands adherence to a set of rigid ethical standards. These high ideals are necessary to ensure the quality of care extended to the patients I serve. As a student of pharmacy, I believe this does not start with graduation, rather it begins with my membership in this professional community. Therefore, I must strive to uphold these standards as I advance toward full membership in the profession of pharmacy. Thank you.
You may be seated. So I have, before we conclude and we move on to refreshments, I have one error that I need to repair. Apparently I need some of Dr. Hamill's memory-enhancing drugs from his natural products company. Because when we introduced the staff, I very embarrassingly forgot the name of one of my staff members. So I'm going to embarrass her a little bit and ask Megan Rockney to please come forward. She's hiding in the back. What makes that somewhat ironic is you might recognize her last name, and since we're in a football stadium, she is a direct descendant of that other Rockney person, somehow associated with football. But anyways, my apologies right now, Megan. Okay, with that, we will close our ceremonies today. We have refreshments in the back for everyone. I would ask the audience to remain seated while the class processes out to the back. So please stand. Cue up the music, and out you go.